Good morning, everybody. This is Jen Kiefer coming to you from Security Health Plan in Marshall Clinic Health System. Today we have with us Megan Pickler from the health system to talk with us again about recovery-friendly workplaces. We did have this webinar on Wednesday and we had technical difficulties with the recording. So we are re-recording this for you to have to watch later on. That's why Jeff and Chris aren't with us because we didn't want to try to reschedule them too. So it's just Megan and I. So Megan is going to walk us through how to become a recovery-friendly workplace and the reasons for it. And so Megan, go ahead and take it away.
Great. Thank you, Jen. I'm excited to share this, concept with all of you. Recovery-friendly workplace is extremely important. And so that's what we'll be covering today. So again, like Jen said, my name is Megan Pickler. I am a manager of community health with our Center for Community Health Advancement, which is a department within Marshfield Clinic Health System. We are the population health arm of the clinic. And my primary role is to oversee AODA programming, so alcohol and other drug awareness programming. So that includes both prevention and recovery, hence why I'm here today. So I will move forward and just discuss what we will be covering. So I'll start out with a brief, capture our, current substance use trends within the nation. And if you are ever curious about, what substance use trends are in your county or even in your city, just let me know. I can get a little bit deeper into that, but just try and keep it at surface level today. And then we'll dive into the effects of substance use in the workplace. So how does that affect you as an employer and, how that affects your employees and their productivity and their performance. And then we'll dive into the workplace culture, really becoming a recovery friendly workplace for your employees and ultimately benefiting you as an employer. Lastly, we'll go into next steps and resources so that you have some good material to walk away from this webinar with. And so, like I said, I will start by covering some brief drug trends here in the nation. So these maps are pulled from what we call SAMHSA, the Substance Abuse Mental Health Services Administration. They are one of our go-to partners in the AODA world, and they administer a national survey yearly, and that is what this data is drawn from. So on the left here, you can see this was pulled from 2012. It's actually a compilation of a 3-year data, 2010, 2011, 2012. So it's an average. And you can see in Wisconsin particularly that the substance use rate on average was around 8%. And so obviously that's already an alarming rate, and that was 8 years ago. And so we're starting at a pretty high rate. We move over to the right, and the substance use rate as of 2018, our latest data, is 11%. So that is a 3% increase in just 6 years. Extremely alarming. We're trending upwards, not a direction we want to be in. So I just want you to pause and kind of think about, why that might be. Why is our substance use, continuing to increase? And I know we don't have the chat feature with us here today, so I'm going to throw out some of those ideas and the ideas that came through the chat feature when we originally went through this webinar. So, participants said the legalization of marijuana, a coping mechanism, co-occurring disorder, mental health and substance use go hand in hand, and we're continuing to see depression and anxiety rates increase due to isolation and other underlying factors. And then lastly, and probably one of the biggest reasons for this increase, is that opioid pandemic that we have been fighting and have been fighting since 2015, 2016. We continue to see overdoses occurring every day. You see it in the news. So unfortunately, those are some of the major reasons for this substance use increase in our nation. And so at this point, I want to pause and just define for you what a substance use disorder is. There's a lot of stigma around substance use disorders, what it is, what it's not. There's two sides of the pendulum. Some people think it's a choice, and others think and know that it's a disease. And we follow science, and science has determined that substance use disorder is a medical illness. It does affect the brain, along with behaviors and other psychological symptoms. It is in the DSM, which is the big criteria we use to um, diagnose an illness. So I just want you all to be aware that your employees may have a diagnosis of substance use disorder, and it's just important to recognize and know that again, this is a disease that they're battling, and more importantly, it's a lifelong disease. It's chronic, right? So substance use disorder lives with someone forever. It doesn't mean that they're using forever. I hope not. I hope they find recovery, which we'll define a little bit later. But just understand that this is a lifelong journey. People in recovery and who have a substance use disorder choose, to be in recovery daily. So again, just a disease that, people are fighting on a daily basis. And at this point, I do want to point out that 1 in 11 working adults do have a substance use disorder. So again, very important for you to recognize that as an employer so that we can support those employees. And then another interesting fact I want to point out is that 75% of adults with a substance use disorder in the workplace are there without treatment supports. And ultimately, without treatment supports, this impacts the employer, and actually, can cost that employer upwards of $6,600 annually. So it's important for us to be here today and talk about how we can support those employees. So, ultimately so that they can get healthier, right? That's our main priority, but also then to help the business. And so we're going to move into what substance use or how substance use affects the workplace. And so I'll let you read through what those negative effects may be on the workplace. They shouldn't be too much surprise to you, but again, this is why it's so important that we are continuously there to support our employees so that this does not happen. So there's a difference between someone who is actively using in substance use and someone that's in recovery. And we really want to get, our employees to recover, right? So just be aware of what, these negative effects are and why we want to support our employees so much in their recovery journey. And to help you do that, I do have a tool for you to use, and that is the substance use cost calculator. And so I would just encourage you to go to this website at the bottom of the screen and, just plug in, your own unique statistics about your own business. So how many employees do you have? What line of work are you in? What type of insurance do you have? Do you do drug testing? Everything like that will spew out a general cost of what substance use, the number that substance use has, and it impacts your own place of employment. So I just encourage you to do that. And then I really wanted to move into, recovery. That's kind of why we're here today. So there's substance use, and substance use is very real and important to address, as we should always, be encouraging employees to seek help. And I guess at this point, I want to also just mention that I'm not asking that, most people drug test prior to employment, right? I'm not asking that if you get a negative or a positive drug test back that you still continue to hire that person. To me, that tells me that that person may not be ready to integrate back into, a workplace, and that they need to seek help. But then there's this other concept of, like I had mentioned before, of, just the lifelong journey. And, just like cancer, and being in remission and coming out and all of that, substance use disorder is kind of similar, in that, relapse does happen. And so because somebody is at a place of employment for upwards of 40 to 50 hours a week, it's important that we support those employees in the best that we can do to help them not move into that, place of negativity and darkness and using. So recovery, it's a process. We choose it every single day. We work on it every single day. And so again, this is just for you to recognize that, it's not just a one and done, oh, that was a time in my life. Recovery is real, and we as employers can be, supportive of that. And so lastly, before we, wrap this up, I really want to take some time, or sorry, I have a couple more slides. I don't know why I said I want to wrap this up. I would love to talk about this all day, every day. So next, I'm going to move into workplace culture. So there's a couple of different ways to think about workplace culture. There's the drug-free way and there's the recovery-oriented way. And so drug-free is an older way of thinking. Drug-free is, here's an example of drug-free. You randomly drug test employees, throughout the year, and if you get a positive drug test, they're fired, right? So that's pretty harsh, and it's just kind of the way our society has been, kind of forced to think over the past years. Well, knowing that, we had a opioid pandemic, we're still fighting the opioid pandemic, substance use is on the rise, we are going to be seeing a lot more people in recovery seeking work. And so that is important for us to know and recognize, and then really learn and, you know, change our, way of thinking so that we can also be supportive of those employees. Again, 1 in 11 workers have a substance use disorder. So it's really important that we change our ways and adapt so that we can, have the best working productive employees on our job sites. So with recovery-oriented employers, it's important to, put some of those practices into place so that we can best support our employees. And so I'll give you a few examples of what a recovery-oriented employer might look like. So the first example I'll give is, maybe you have an employee who discloses that they do have a substance use disorder and that they're actively participating in AA, Alcoholics Anonymous, and that meeting, occurs every day at noon. So as an employer, something that we can do is avoid scheduling meetings at noon so that that employee or those employees can, continuously take care of themselves, as a treatment measure for themselves and supportive measure. Maybe another thing that you can do as an employer is, one thing that's really been gaining traction. Again, this is a more newer model, so we're continuously learning every single day about being recovery oriented. But one thing that you can do is, maybe identify somebody who, and maybe they come forward and tell you that they're in recovery and they would love to support other employees in recovery. So maybe that employee becomes a recovery or a recovery coach, and maybe the employees seek that person out when they're struggling or they have a trigger or they overhear, their buddies next to them talking about their night last night and how drunk they got. And so, allowing for that ability to kind of pause your work and just, talk with that recovery coach and tell them how you're feeling. That's a great on-site support that you can help, support in your own place of employment. So those are just a couple of really simple examples of how we can move to becoming more recovery oriented. And that leads me into my next slide of, what we are doing as a health system to help support this concept. Again, very new. And so we want to, firm this up and then help all of you as employers to learn more about this and actually implement this in your own place of employment. So the ABCs, so those are our priorities for the health system. The A stands for AODA. B is behavioral health, C is chronic disease, and S is social determinants of health. So I'm just putting this out there to show you that this is a priority, AODA, and within our AODA priority, we have recovery-friendly workplaces. And so we will be having WARM students, which are basically our medical students that need internships around community work. We have 2 of them coming on board next month, and they will be helping us firm up what we're calling a recovery-oriented employer workshop. And so that workshop will be offered to all of you as employers to really learn about, the substance use trends, dive a little bit deeper. This is kind of a teaser for this webinar, and then really get into the concepts of recovery and substance use disorder and how we as employers can help, and really tangible examples, including policy and education. So be on the lookout for more about that in the future. And then lastly, I just want to provide this resource slide for you all. The top one I would highly recommend you going to. That's the SCAOTA .Wisconsin report on substance misuse and Wisconsin workforce. So very timely and directed to our employers here in Wisconsin. And that was, developed and released over the last year. So very up-to-date information. And, Wisconsin in general is a leader in this area. So there's some really good examples in that report that I would ask you to look at. And then lastly, I just want to open it up to all of you. Jen, do you have any questions for me?
Yeah, excuse me. Yes. Let's see. So the first one that came in was, what is the temperature or the pulse of the employers you've talked with about this, if any, about the shifting of the mindset from drug-free, kind of, one and done, to a more recovery-oriented environment? What's the pulse of what you've been seeing so far?
Yeah, so we definitely have talked to some employers here locally in Marshfield, and the pulse that I've been getting is, why go the extra mile? Why put in more work? This is a them versus us problem. And so that really tells me to just start with education and really express, the numbers that this is affecting the employer, that upwards of $6,600 a year. And then also just, getting employers to understand that, that in the past, the stereotype has been very negative for people who are, have substance use disorder. And, it's important to recognize that this can be your brother, this can be your mom, this can be your cousin. And so we are going to continuously see people in recovery seeking out work, and it's important to recognize that. So, it's a work in progress. It's not perfect right now, but hoping that employers will gain traction with this new ideology.
Okay. The next one is, what kind of communication will SHP customers, employers get about the new workshops and the timing of those?
Yes, good question. So I've been, in contact and working with Dave Scheuer over at SHP. And so, once this is a little bit more firmed up, we will, contact each of you and invite you to participate in this workshop. And it also sounds like maybe a follow-up to this webinar might be helpful in the future. So be on the lookout for both of those things. The workshop will be, it'll be available to all of you.
Okay. One other question that came was, how does drug testing ever factor into a workplace anymore? I think you touched on this just a little bit, but if you could go over that again, if drug testing is part of recovery friendly ever, or how that works.
Definitely. Good question. So, I definitely think there's a place and a time for drug testing, especially at the beginning of an employment, because you do want to kind of weed out who's ready and willing to work and who, may still need to work on their treatment in a substance use or with substance use disorder. But then, once somebody is employed, that's really where the recovery friendly recovery oriented employer ideology takes over. And we really want to cultivate a place of trust and honesty. And we would hope that, with becoming a recovery friendly workplace, that employees feel that they can come to their supervisors and let them know when they're having a bad day, or maybe that they did relapse last night and they need to go seek help. And that's when the employer recognizes and says, yep, thank you for telling me. Go get your help. We will talk about a plan and put a plan in place for you to return back to work when you're ready. And so that's the difference. So, the old ideology of drug testing is to catch people, punish them, right? And now we're moving more towards, maybe you still do drug tests, but maybe that isn't so harsh of a punishment, right? Maybe it's not the end all be all of firing, but seeking help.
Okay. And then one final one. So how does a substance use disorder get diagnosed? Is it a medical doctor? Is it a social worker? How does that process work? And what could employers do if they maybe are seeing signs of, something might be wrong or happening with their employees? Where can they turn and how can they help them?
Yes, definitely. So it's important as employers to know where those resources are within your community, and seek out a professional. So a professional for substance use disorder would be an addiction nurse or a substance abuse counselor, or but ultimately it's best to just start with your primary care physician. So again, in the workshop we'll go over what are those signs and symptoms of somebody who may be under the influence, and then what can we do about it as an employer.
Okay, sounds good. I think that's all the questions there were. So with that, we'll make sure that everybody's going to get the slide deck. In fact, that's already happened. We sent that out the other day, so we'll be sending out this video. And we thank Megan a lot for her time. We'll probably see you again soon. We'll have you as back on as a repeat guest. So thanks a lot.
Great. Thank you, Jen.
All right. Bye-bye.
Bye.